Are you suffering from neck pain, headaches, migraines, temporomandibular disorders, or jaw pain, facial pain, any of those things? We always tend to some degree, look at and address your upper cervical spine, particularly your first three cervical vertebrae. Your first one we call your atlas, second one we call the axis, and then of course the third one is your third cervical vertebrae. And the way I like to explain it to patients, because it's simple, is that we tend to look at your yes joints. So if you nod your head yes, that's going to be how our occiput, the base of our skull, relates to our first cervical vertebrae, our atlas. And one of the primary movements of that is being able to nod our head forward and backward, a few degrees of movement. Then we have what we call our no joint. So, right, turn your head as if you were responding no, is how the first cervical vertebrae correlates with our second. So how atlas correlates with axis. And then if you just tend to say maybe or I don't know, that's when we tend to look at how our second and third cervical vertebrae correlate in more of a subtle side bending movement. What we tend to know and what we see in a lot of our long-term patients that might have chronic issues is that they have adopted a very forward head posture, so they end up getting a lot of compression occurring between the base of their occiput, their first and second cervical vertebrae. So a lot of our treatment will focus on good manual skills to address the muscles that have become tight and restricted, cervical mobilization techniques and or manipulation to address loss of movement that might occur in what we call these facet joints. And then of course, as always, we have to supplement that with some good postural correction exercises.